This mini lecture is going to review the general survey and the mental status exam. Our learning objectives include, by the end of this presentation, you will be able to describe the purpose of the general survey, list the elements of a general survey and a mental status exam, and lastly, analyze strategies the nurse should employ to obtain accurate data during the general survey and mental status exam. The concept is cognition and the exemplar is mental status exam. You'll see throughout this presentation that there are a lot of overlaps between the general survey and the mental status exam, but the specific exemplar for this concept is mental status exam, and the concept is cognition. The purpose of the general survey is to provide the nurse with a first impression of the patient. And this general survey data collection really starts the minute you set eyes on your patient. As the nurse, you're going to be using observation to gather important information regarding your patient's health. The general survey can help the nurse understand the patient as well as the situation or in the situation the patient may be experiencing. And it can provide clues about the patient that might otherwise not be identified, and also help you identify abnormal findings that can be indicative of both or physical or mental health concerns, or both physical and mental health concerns. So the general survey is a comprehensive view of the patient, and it's that first look that you get. So you start a general survey observation assessment the minute you meet the client. But basically, we talk about the general survey being that baseline data that you're collecting after you've received the health history, after you've done the interview, and before you start doing a physical exam, the head to toe. You're observing characteristics, you're observing behaviors. There are several elements that you will look at in a general survey. The elements include the patient's physical appearance, the body structure, mobility, and behavior. In addition to those elements, you will also be looking at the vital signs and pulse oximetry data that you have collected. The first component or first element of the general survey is the physical appearance. So you're looking at the client's age. Does he or she look like their stated age? You know, does the patient appear to be older than their actual age? Does the patient appear to be younger than their actual age? You're looking at the client's sex. Does sexual development align with the patient's gender and age? You're also going to be looking at their height and weight. Are the client's height and weight within normal limits? You'll see I abbreviated that here as WNL, within normal limits. You're looking at the client's level of consciousness. Is he or she alert and oriented? Is he or she responding appropriately to your questions? The skin color will also be something that you assess within the general survey in the physical appearance category, and you're looking at pigmentation. Is it consistent with the person's ethnic background? Is the tone to the skin even, and is the skin intact? And then you're also looking at facial features. Is the patient's face symmetrical with movement? Does the left side move the same way that the right side of the face does? Is there any evidence of pain or distress within the patient's facial feature expressions? Some abnormal findings that you might identify in the physical appearance category of the general survey is perhaps the patient looks older than their stated age. This could indicate that the patient has some type of substance abuse or chronic illness. Does the patient have facial grimacing, like this picture on the right-hand side? And that's indicative of pain, or can be indicative of pain. On the left-hand side, you see a picture here of a person who has facial drooping, which could be indicative of a stroke. And another abnormal finding in physical appearance could be shortness of breath or increased work of breathing, which would indicate that the client could be experiencing respiratory distress. The next area we want to look at in the general survey is the body structure. So is the patient's height in the normal range for the patient's age and genetic background? And that's referred to as stature. Does the patient appear to be within the normal range of their weight for their age and genetic background? Is the fat distributed evenly? And you're looking at the nutrition. When you're looking at symmetry, you're really looking at both sides of the body, which is called bilateral. So you're looking at body parts, and you're trying to identify if the body parts are symmetrical or the same bilaterally, or are the body parts in proportion. When you're looking at posture, you want to ask yourself, does the patient stand erect or comfortably with a straight back? And when you're looking at their position, if they're sitting, are they sitting in a relaxed manner? If they're standing, are they standing with good, we looked at the posture, but what does the position in their body look like? And lastly, body build and contour. Is the patient of normal proportions? I know we tell you not to use normal, but does the patient's arm span equal the height? Does the body length from crown to pubis, or from the head to the pubic area, equal the length from the pubic area to the sole of the feet? Do you notice any deformities, any obvious defects in the body contour or build? In the picture on the right here, you have a patient that we would describe as having cachexia, which is excessively under normal weight. The picture on the left, the person is obese or has obesity, and that's excessively over normal weight range. You also might have someone that has a slumped posture or deflated appearance, and that can indicate depression. During the general survey, when you are assessing somebody's mobility, you're looking at their gait. Does the patient walk smoothly with an even pace? Do their arms swing appropriately? Is the walking well balanced with accurate foot placement, like this picture on the right-hand corner? You're also looking at range of motion. We will abbreviate this in documentation as ROM. Does the patient have full mobility to each joint? Are the patient's movements coordinated, smooth, planned, and accurate? In the mobility category, some abnormal findings include limping, which may indicate an injury, shuffling gait or dragging the leg. This is depicted in the picture on the left, and that can indicate several different neurologic issues and typical aging. Sometimes you'll have the older adult who shuffles with their gait because they're afraid of falling. Can also indicate previous stroke or chronic illness. A limited range of motion or limited ROM may indicate somebody's suffering from arthritis or may have had a past injury, so it has limited their range of motion. And lastly, let's look at the client's behavior when you're performing a general survey on your client. You're looking at their facial expression. Does the patient demonstrate expressions that are appropriate for the conversation that they're having? Meaning, if they're telling you how happy they are they smiling? Or if it's culturally appropriate, because a lot of cultures it's not, but are they maintaining eye contact? You're also looking at their mood and their affect. Is the patient interacting appropriately? Is he or she comfortable and cooperative and answering questions and doing what you're asking them to do? How about their speech? Does the patient speak clearly? Can you understand what the patient is saying? Are they dressed appropriately for the weather, for the season? Again, being culturally aware of the dress when you're assessing this. Does the patient's clothing fit correctly? And personal hygiene. How does the person look as far as his or her grooming? Are they clean? Are their fingernails, do the fingernails have dirt underneath them? Are they, do they have a foul odor? And again, you're assessing this as aligned with their age, their occupation, and their socioeconomic status. So you may assess personal hygiene on a 12-year-old may be very different than a personal hygiene in somebody that's 50 or 60. It's relative to who you're assessing, but these are categories or things you're looking at in the area of behavior for the general survey. Some abnormal findings for behavior that you may come across, and what they possibly could indicate. If somebody has slurred speech or abnormal facial expressions, that could reflect physical or mental concerns. That's also the case if there is a change in personal hygiene that could indicate mental or physical concern or illness. And then if the clothing is too large or too small, that could indicate a change in his or her weight, whether that be a loss or a gain. So let's talk about how the nurse's behavior or strategies the nurses can employ to get accurate data from your client when you're completing not only the general survey but also the mental status exam, which we'll talk about in a minute. But your approach and how you engage the patient as the nurse can influence the quality of the data that you collect from your patient. So it's very important that you are confident, right? So being confident helps the patient to feel safe with the nurse's care. Being confident is also acknowledging when you don't know something and you need to seek additional help. Being respectful. Being courteous and polite demonstrates professionalism, which will help the patient feel that you as the nurse value who he or she is. You need to be calm. So if you are calm, your patient will tend to relax and be more open to communication and assessment. They will feed off of your calmness or lack thereof. We talked a good bit week 1 about actively listening. You want to concentrate and understand and respond appropriately. Remember that the patient possibly sharing with you information that is very personal. And if you can actively listen, you're going to build a more quality relationship, a trusting relationship, and you'll be able to encourage the patient to share personal information. As a nurse, you want to be truthful and genuine. You want to, if you are sincere and you're real with the patient, they will trust you more and be more open to communication and assessment. And lastly, we talked about this as well, you're going to want to make sure that you emphasize confidentiality. You want to make sure your patient realizes that anything that he or she says to you is confidential, and that again will promote that trusting relationship and the ability or encourage the patient to share with you, the nurse. Now let's look at the exemplar mental status exam, again, under that concept of cognition. Mental status refers to a client's level of cognitive functioning and emotional functioning. What I mean by that is cognitive functioning is the client's thinking, their knowledge, their ability to problem solve. Their emotional functioning are their feelings, their mood, their behaviors. And it's really important for you to realize that health is a state of complete physical, mental, and social well-being. It's not merely the absence of illness or disease. Mental health is a state of well-being where the clients or the individuals know what their abilities are. They realize their abilities. They can cope with the normal stressors of life. They work productively and they're able to contribute to society. And a healthy mental status is needed to think clearly and respond appropriately and function effectively in our ADLs, which is an abbreviation you'll come to know, which stands for activities of daily living. And truly, one cannot be totally healthy without mental health. And a healthy mental status is reflected in one's appearance, behaviors, speech, thought patterns, decisions, and again, one's ability to function in an effective manner in their relationships in home, work, social and recreational settings. And one's mental health really can vary from day to day depending on a lot of factors. So there's several factors that can put a person at risk for impaired mental health. You can see these factors here bulleted here. You have social and economic factors, unhealthy lifestyles, if they are exposed to violence, personality and spiritual factors, as well as cultural factors. Problems with their neurologic system can affect mental health, and psychosocial development, whether they have issues or where they are on their psychosocial development, those different levels. So there are many things that affect mental health, and I just throw this slide in here so you're aware of that as you're assessing someone's mental status. So how do we assess someone's mental status? What is this mental status exam or mental status assessment? In your textbook, page 83, there is a yellow box that goes into detail about general routine screening versus specialty assessment of the mental status. I am not expecting you to be able to perform specialty assessment on your clients, but I do expect you to be able to routinely screen somebody, and it's very similar. I'm hoping you can pay attention to how it overlaps a general survey. So you're doing that general survey that we just spent a good portion of this presentation talking about, and that mental status exam, and they really overlap, okay? So an assessment of mental status is completed or accomplished by interviewing the client, getting that subjective data in the nursing health history, and observing the client, observing his or her behaviors in that physical exam. So in the subjective data in the nursing history, you're going to be asking questions like, do you drink alcohol? Do you use illicit drugs? And then exploring further into those answers as they answer appropriately. And you're also going to be collecting objective data. So what's their level of consciousness? What does their posture, gait, and body movement look like? How about their behavior and affect, their dress and grooming, their facial expressions and speech? All of this should be very familiar to what we just talked about in the general survey. Assessing orientation, and you'll be doing this orientation assessing by asking them, do you know where you are? Can you tell me your name? Can you tell me your date of birth? Do you know what day of the week it is? Who the president is? And we'll go through different questions that you can use to assess their orientation. You also will be needing in this mental status exam, you need to observe your client for any type of suicidal ideations or any type of concentration or thought process deficits, and you will be assessing recent and remote memory. So I'd say if you're comparing the two, the mental status exam over top of the general survey, you're looking at their memory, you're assessing their concentration and possible suicidal ideations. So that's if you compare general survey to this mental status exams, the bottom bullets are kind of over and above what that general survey elicits, if you will. So here I have listed out the parts of the mental status examination. Remember, your elements of a general survey include the physical appearance, body structure, mobility, and behavior, which are included in several of these bullets. But in addition to that, for a mental status exam, you're looking at thought processes, perceptions, cognitive abilities, which include orientation, concentration, that memory part, their ability to perform abstract reasoning or judgment. And these are parts of the mental status exam. So again, let's circle back around to our objectives. Hopefully you now are able to describe the purpose of the general survey. You can list the elements or parts of a general survey and a mental status exam. And you hopefully will be able to describe or analyze how you as nurses can use certain strategies to obtain accurate data during both the general survey and mental status exam. Please come to class with any questions or anything that you need more clarification on. And as usual, take good care.